So Richard, can you tell me about the Matilda Project? How did it start?
Sure. Well, my wife Wendy and I were living in Uganda for a couple of years and then Zimbabwe for a couple of years, and realised the effect that HIV was having in the rural areas, and then experienced a friend of ours dying of AIDS. It became something that was very personal to us and became something we wanted to do something about, and yet we didn't know what. We asked around and were put in touch with some great groups who were providing practical care to individuals in the rural areas and village who were dying of AIDS, providing very practical support to them so that they could die with a measure of dignity and a measure of comfort, and allowing the community around them to feel they were able to do something about this pandemic that was affecting them.
So that was a few years ago, and the Matilda Project has grown hugely. Tell us about what are the ranges of different things that you're doing now, supporting from ACET Ireland through to ACET Zimbabwe.
Sure. So we started providing teams with the practical goods that they needed to bring care. So that was simply soap, washing up liquid, bleach, some cloths, and very practical bits and pieces that they needed to provide care to people in their community. But that gave hope to the teams and allowed the teams to dream of what could happen this project. And as that happened, they came back to us with other ideas and other needs in the community. We started to realise that there were lots of child-headed homes where the eldest child in a family was left alone to look after their brothers and sisters from maybe as young as 12. And we started to provide food packs for those families, especially as a number of harvests failed and there was significant hunger in the area. As that developed, we began to realise that in some areas it was better to provide breakfasts within schools rather than risking stigmatising a specific sort of family. In places where actually 2/3 of the kids in the school were already orphans, we could provide breakfasts very easily for the whole school that brought kids back into school that had dropped out. It ensured their concentration improved within school, and it gave them quite an incentive to attend and then to study hard and to be part of school life.
So how many children are being fed each day through the programme in schools?
It's about 2,300 at the moment.
And is that a professional team or is it volunteers? How does it happen?
It's teams of volunteers. Each school has 3 teams of volunteers and they sort of do a week each in rotation. They collect the firewood, they collect the water from the local well, which might be a couple of miles away. And
they carry it on their heads?
They carry it on their heads. Wendy's been there and attempted to do the same thing. They build a fire and cook in these gigantic oil drums enough porridge for the kids in the school, which can be sort of 600 to 800 in each school. And then at first break, I think around 10 a.m, the kids are brought out and each get a bowl of porridge.
So tell us about the home care programme. How many households do you think are being visited in a month in these rural areas? Any guess? It varies wildly. I think there's 10 villages in each of the 2 communities around the Metopus, and similarly about 10 villages down in the south of Zimbabwe. And it varies from 10 to 15 per village to sort of much bigger numbers. And what about?
You'll have to check the website to get the exact figures.
Okay. What about school fees? How does that work?
So we did a community audit when we started the school breakfasts and realised a number of kids had dropped out. Again, it depends on exchange rate, but can be around $6 to $9 for primary school and up to $15 per child for secondary school per term. There's 4 terms per year in the Zimbabwean school system. And so we found out how many kids had been forced to drop out of school and arranged donors who would provide the support to pay their school fees.
What does it cost to feed a child for a month?
Well, it's 20. So the school breakfasts work out at about 20 cents a breakfast. the food packs have ranged from 25 to 45, but about, I think it's closer to 25 at the moment.
What,
US dollars.
Okay, so and how long does a food pack last a family?
They provide for about a month.
Okay.
And it's, supplementary food.
So the support comes mainly from a group of friends and communities in and around the teams in Dublin.
Yeah.
Led by you and your wife. How can people help? How can they get involved?
Well, I mean, anyone is welcome to obviously donate, and they can visit the Matilda Project website to see how to do that, and to sign up for the newsletter and hear what's happening, but also to get in touch perhaps with a community themselves and to start building up a similar relationship. Something that we've realised is this is very easy to do. It's very easy to find a group on the ground that are wanting to make change but need some measure of resources to do so. We're in email communication with the teams a couple of times a week. We text backwards and forwards and have a couple of phone calls most weeks. And by doing that, have become part of the team rather than simply a donor. So there's now a 10-year relationship between us and the teams that we're supporting.
Tell us about Willard, who leads those teams in the rural areas.
Willard he's a gem. He's a Salvation Army captain and has become very much a leader of the community. He's one of those inspiring characters who just throws himself into where he sees the need and manages to galvanise loads of other people to follow him. He started by supporting the home groups and training volunteers and releasing volunteers into the community to look after others. In doing so, he's got to know all of the community leaders and maintains a very close relationship with the community leaders so that they can come to him and tell him what the needs are in the community. The most recent venture has been to provide access to hospitals in the community. He realised that lots of people were dying unnecessarily, not because there wasn't treatment available, but they simply couldn't access it because they couldn't get to the hospital. And so he provides lifts to the hospital. There's the 10 villages in the area, and he takes one village a day on sort of 2-week cycles, so that sort of everyone has access to the hospital sort of once every 2 months, and that fits alongside the other things that he does.